Hi, everyone. This is Ferdinand from Elective Africa. I'm a program lead at Elective Africa. And today we want to talk about the typical experiences that students or participants have in premed shadowing internships abroad. So just to start off, we've been doing this for over 15 years now. And all through these years, we've accumulated, or we've been working with students to curate these experiences, and through their feedback we've tried to iterate the program to match your experience and also just to meet you, to help you meet various objectives. This includes your clinical hours, your independent, if it's for independent purposes, you just like to do it for fun or to learn or to travel or to meet your clinical hours as an educational requirement. Also, that is we've curated the program that way. And why the program is very unique is, one, because you get to, there's the first obvious answer, which is you get to direct patient access and all those kind of activities in a low and middle income country, in under-resourced settings. So there's also that. There's also the difference in healthcare systems. There's also the different diseases that you get to interact with, which is also interesting, such as tropical medicine. There's also other social cultural issues that affect healthcare delivery. We have poverty, which is one of the things, because patients get to go to the hospitals when it's a little bit too late, to see how patients the conditions, various conditions or diseases in their late stages. So there's also that aspect. So there's so many things about that I'd speak about. But for this is just this session we're having, I'm going to touch a little bit also about the program objectives, the clinical sites. Of course, we are in Africa, and our main destinations are in East Africa, specifically Kenya and Tanzania and Uganda. Both countries offer different, they have different experiences, but they are somewhat interconnected, just as is in any developing country anywhere in the world. Then there's also specialties offered. So this depends on the disciplines that you are focusing on back in school. Then we also have the program evaluation. We also have the placement requirements, of course, the shadowing principle. So we have pre-med programs, we also have electives. Then we have, for depending on what year you're in, we have a program for all that. Then there's also the hospital specialties. We also have the hospital work experience. Then the program organizer value addition, which is Elective Africa. Then also the program package itself. Then lastly, how you can contact us or how you can connect to us. Elective Africa has, as I mentioned earlier, Elective Africa has been organizing these expeditions and mission trips for close to over 20 years. So we have a whole lot of experience doing this, and we've tried to curate the programs again just to meet your individual objectives. We follow or adapt the AAMC guidelines for pre-medical and medical students during clinical experiences abroad. So there's so much value that students or participants get to get from such experiences. And also, just to mention about the picture, that's one of our students, two of our students actually, in Coast General Hospital in Mombasa. So both just after their rotations. Then the key benefits is just the clinical enhancements. There's the cultural aspect about it, so competence, because as we already know that the world is becoming interconnected. So just having a global health edge is usually very, very, very important as an aspiring healthcare professional. Then there's also your development of just your soft skills. Yeah. So you have communication skills, teamwork skills, and confidence, your leadership, resilience. All these aspects are very essential to be and they'll come in handy later into your career. So anyone who would like to practice healthcare has to have these essential skills, because you have to work with doctors when you're coming up with treatment plans and all that kind of stuff. You need to teamwork. And it doesn't have to be necessarily everyone has to come from a similar background from you. You might be different doctors or practicing professionals from different parts of the world, but then you have to work together to provide care, right? So there's also that aspect. And there's also the program suitability. For this, it comes very directly. So, anyone who is enrolled in a pre-med program, and also for medical electives, which will have another session later, specifically for that. or are very welcome to join our program. Also, we have other customized programs for high school students. So also don't shy away. Also, to you can apply, reach out to us, and we can customize that for you. So for the AAMC guidelines for our placement, so far students get mentored and supervised with the local healthcare staff. Very exciting just to work with the doctor, with an actual doctor, an actual physician. Then the students are usually under instructions not to administer medicine. Of course, this is inconsiderate to the AAMC guidelines. However, you have to build your or cultivate a good relationship with your doctors so that they can give you a little bit of activities just in the hospital, so that you're not just shadowing, but also getting involved in doing a little bit of other activities in the hospital. Then students can assist, as I've mentioned, in non-invasive procedures, basic procedures, and this is usually after adequate orientation. So you have to be very assertive. Then also the patients and students' safety is very paramount. Of course, as we say in healthcare, do no harm. And just as they trained you, or in medicine, that's the paramount kind of idea. Then also the students should appreciate the cultural differences. So you have to come with the willingness, or that you're coming, there's the diversity part of it. So you have to come very prepared to embrace or interact with diversity, because you're going to join a new team, right? One that comes from a different background from you, and also other students who are international students in other medical schools or premed programs all over the world. Then also students also must maintain utmost confidentiality. So these are just ethics in medicine. Also, these are usually observed. Of course, once you're here, you'll be taken through a hospital induction that will help you just understand, or just go through some of the SOPs, the standard operating procedures, the guidelines that will help you just work in the hospital. Again, here's another picture of our students just outside the General Hospital. Then which takes us to the program objectives now. So first, this patient care, where you get to enhance and practice skills such as history taking and general and physical examination, developing differentiation, etc. Then there's also medical knowledge, whereby you get to demonstrate knowledge about different established and developing medical sciences, and also their application to patient care. So there's also that, and ideally for medical students who are already enrolled in medical school, is just transferring what you learned in class to an actual real life hospital. Then there's also practice-based learning, whereby it's just learning by doing, by being in the moment or in an actual hospital, facing real life patients, and just working with doctors or shadowing them as they provide care. Then there's also soft skills, as I mentioned. There's professionalism, which I want to repeat. Then lastly, there's system-based practice, whereby you get to experience healthcare in two different healthcare systems, and you get to compare the local healthcare system here and the one in other parts of the world, such as the US, such as the UK, such as Europe, Hong Kong, and all these places that we get or have affiliations to universities. Then we also have the hospital specialties. So we have several, including the ones displayed in the screen. So we have medicine, we have general surgery, we have obstetrics and gynecology, pediatrics, accidents, emergency, and trauma. We also have psychiatry, ENT, ophthalmology, gender violence and recovery centers. We also have orthopedics, physiotherapy, etc. So we also have other subspecialties and other specialties of interest or departments, such as dermatology, that you can inquire about. So you can reach out to us if there's availability. Also, you will be, we'll connect you to that and organize that experience for you. So this is also one of our students in one of the she was doing, she was in the surgical elective program, which you should also check out on our website, or just reach out to us directly, info@electiveafrica.com, to get more details around it. So for available clinical sites, so this have limited them to our pre-med destinations. We have Kenya and Tanzania. So we have rural Kenya, urban Kenya, and also coastal Kenya. We have Mombasa, which is, usually very famous because of the Coast General Hospital. It's the second largest hospital in Kenya. So you get a chance to shadow doctors here, work with them. It's very exciting. It has over 750 beds and serves a population of up to 3 million people. So it's very busy depending on the department that also you'll choose. And example, in surgery, we have over 5 to 10 cases, surgical cases a day. For births, it's almost 7 births a day in the obstetrics and gynecology department, and on and on and on. So also work experience now. What awaits you in the internship abroad, right? We also have just understanding how we manage and advance medical cases and tropical diseases. So tropical diseases, very unique here. This include malaria, dengue, all that set of diseases that you get to learn and see. And we have global health tutorials, which are very exciting sessions that happen in the residence. So we normally invite your preceptors or your supervising doctors or a representative from the hospital who is a healthcare expert or a caregiver who comes just to the residence and discusses your observations during the week. Or if you're very interested in a particular subject, also they get to discuss that, and you can share. We can discuss we can have a discussion between our participants, the different observations, compare and contrast different systems, see what can be borrowed from different systems. And it's not just about the healthcare and resources. There are also other minor aspects, such as empathy in care delivery. Like we have, systems, healthcare systems, which are commercialized. So it's more robot-like. So, unlike most in Kenya or most developing countries, healthcare is usually more empathetic, and doctors are usually treated as part of the family. So there's also that aspect that you can see, how can we be empathetic when you go back, when you're providing care, just the humane part of it. So there's also shared discussions, and also technology, of course, is usually a key area. There's an advance of technology as well, and how do they affect healthcare delivery, and do we think that will affect, how will that affect the healthcare systems of developing or low and middle income countries? So they're very exciting and insightful discussions that they kind of broaden your horizons on global healthcare. Then there's also delivery of healthcare with available or unique limited resources. So again, there's that aspect as well. Then also the different hospital and cultural setting. So there's also the doctor-patient interaction, as I mentioned. It can be commercialized. Some is very empathetic. There's a way they handle patients in different parts of the world. How does that, what can we borrow from where, and how does it affect general care delivery? We also have social cultural issues, again, as poverty, as I mentioned earlier. Then the next section now is hospital work experience and a more deeper understanding about the programs or shadowing programs, and generally just elective programs, right? So you have to get to gain a deeper understanding into medical care in developing countries, and also getting a global perspective of that. There's also getting experience into what a healthcare career entails. So especially for premed and high school students, it's important to mention that there's a fallacy or just the excitement of, I'm going to be a doctor. But what does it really entail? There's a lot of, you have to have a mental capacity to handle the cases that you get to see in the hospital, because sometimes unfortunate that you might lose a patient, and how do you handle that? And how do you provide care to a terminally ill patient? Sometimes it can be very overwhelming. And just seeing doctors and healthcare givers go through this, and how do you develop your resilience or your mental capability just to handle that case and still think straight, and just reduce the mistakes that can be made. Like, anything can go wrong, especially if you can't handle the pressure. So how do you also build this up? Then there's also exposing yourself to a new culture, which is very exciting. Why? Because you get to interact with a new culture, and just providing care to someone who speaks a different language from you, and a team that speaks a different language from you. Hence, building on your cultural competence is very key and very essential, especially as the world keeps growing connected. Then lastly, your direct interaction with doctors, nurses, clinical officers, just healthcare givers in the medical services delivery is very important. So there's a nice picture of our students there in one of the beaches, and we encourage our students to explore the destinations, to learn about the destinations. Mombasa itself is a very old city. The Portuguese were here almost 500 years ago, then the Arabs, then the British. So all that is dotted in the architecture, the food, the music, all that is dotted. It's just, you get to explore this and you get to interact with the locals and understand their cultures and just see how it ties up to the social and healthcare fabric of the communities here. So first on the program evaluation, so we have the relationships with patients, the ability to deal with patients, family members, professional relationships, dealing with the team in the hospital, your peers. There's also physical and mental fitness examination, your oral presentation during the global health tutorials. We have the learning interest. We also have history taking, problem solving, and critical thinking. We also have knowledge and understanding of disease. If you can try tell a disease by just looking at the symptoms, we also have a general attitude and behavior. So also that. So ideally intuitiveness and enthusiasm towards the program. How do you show that? Also another nice picture of our students in one of the excursions with a backdrop of giraffes. So there's also, a lot of excursion experiences that you get to do. The program runs from 2 to 12 weeks. However, most of the students do 4 weeks, which is usually the standard of this program. But then if you can stretch it out to 8 weeks, because the more the merrier. And the more the number of weeks you're here, the more you can explore more and do more. Then also the locations are usually in a government and community health facility. To get the most out of the program, you have to be very assertive. You have to be willing to work some, night shifts, weekend shifts, just to add on your clinical hours. And also you get to get more learning experience when during the odd hours, like a night shift, because not so many people are in the hospital. So most of the cases will have an up close or a front row seat, just seeing this case. Okay, on a value addition, we have customized placement. Even if you're coming as a group, the program will be individualized. So depending on what departments you're interested in, so this will be individualized to you. Then also there's supervision, hands-on experience. You have a dedicated mentor or a doctor who will be with you, and you can ask them questions. You can follow them around, learn from them directly, etc. We also have the global health tutorials, which are just discussion sessions, which are usually in the residence, and you get to, the doctors get to engage with the students. It just adds an academic flair to it. Medical education sessions with students and participants, and you get to ask them anything, your observation, different questions about the healthcare system as a whole. We also have on-ground support. Then also we have on-ground support. All the Elective Africa team is usually located in the placement destination. So they're literally with you the entire time from morning 8 a.m. up until 6 p.m. in the evening, making sure you've taken your breakfast, you've gone to the hospital, you've been supervised, and also you've taken your dinner, etc. So there's also full catered shared accommodation. So if you have any dietary concerns, that shouldn't be a concern really, because we normally provide safe and secure accommodation. And also meals, we have an open kitchen. If you'd like to whip up an omelette, that's okay. If you'd like to ask the chef to prepare a certain meal for you, also that's okay. Then lastly, we have split lessons. So as we wind up the program package of the fees, what they entail. So first we have customized packages. We have pre-departure support, which assists you with visa guidance and also, checklists, vaccinations, what kind to take or what schedule, what appointments to schedule. We also have airport pickup and drop off. And we also have orientation in the local area, of course, city tour. We also have a hospital orientation, hospital placement fee paid to the hospital. We also have fees to the mentors. And also we have a special accommodation, as I mentioned, with the Wi-Fi and laundry and housekeeping. We have 3 meals a day, which are chef prepared, a fully stocked kitchen, and also a bi-weekly barbecue. Then two-way transfers. to the placement or hospital facility. So in the morning and afternoon. Then we also have every 2 weeks global health sessions with a mentor, the student accommodation site or our placement facilities, which are very safe. And also your safety is guaranteed. So our residences are safe and just operating in the safest parts of the city. They still have a perimeter wall. There's also a security fence. There are guards all through, so your safety is guaranteed. And lastly, we have Swahili lessons for cultural integration. For adult activities, we have a safari, very exciting, the school of making the big fire. Then we also have cultural integration and volunteering. You get to visit a local school and an orphanage just to, provide value to them in any way that you'd like. It can be as simple as teaching them anything you're comfortable with. It can be maths or science, or it can be also just spending time with them or helping them paint their classes. And so there are a whole list of activities that we have to do. And we believe in leaving the communities you're operating better than you found them. Then also lastly, we have outreach clinics. Some of the initiatives are usually organized by the local government or the hospital itself, and we get to join them and go to the communities, and public health professionals get to provide free health consultation, provide awareness as well, and so many other activities that you get to enjoy. And for the basic placement requirements, so at least you have to be, of course, enrolled in a medical program or a premed program. Then you have to be 18 years of age. If not, you have to write to us, especially for high schoolers who might be a little bit younger. So you have to write to us and have guardian consent. Then for application, you have to apply from our website. Then you'll reserve your slot to secure the spaces at the hospital, at the residence. Then lastly, you'll just submit your placement documentation, right? So yeah, that's a testimonial that you can feel free to also check out on our website. And lastly, that's all about Elective Africa. Please share your comments or any questions down below on the comment section, or also you can write directly to us at info@elective.com.